Hi, I'm Erin Power.
And I'm Laura Rupsis.
We're certified health coaches, and this is Health Coach Radio.
This podcast is about the art, science, and business of health coaching.
We share our insider tips to help you become a better coach and entrepreneur.
And we interview expert guests to discover how they've made it in this growing field.
It's time for health coaches to make an impact.
It's time for Health Coach Radio.
This one's for the quantum physics and energetics lovers and those eager to learn more. Our guest today is Dr. Shamini Jain. She lovingly and patiently dispels the woo of energy work, energy fields, mind-body practices, biofield healing, and how our spiritual practices have massive impact on our health. She helped us out a lot using real kid gloves as she explained concepts like presence and consciousness. We also have a fascinating conversation arc around placebo effects. How if the brain believes that we've healed, that isn't really a bad thing. For those of you listening that already speak this language, you'll really love this conversation. And if you're newbies to it, like we are, you'll really appreciate Dr. Jain's way of making it feel gettable. A quick promotional message, and then we'll be on our way with this episode. We've been working on something pretty cool behind the scenes that I'm excited to tell you about. My Primal Coach is a convenient app-based health coaching program that delivers daily lessons with actionable tips for losing weight, gaining strength and energy, sleeping better, managing stress, and more. It provides personal one-on-one coaching to help you stay on track and reach your wellness goals in just 12 weeks. My Primal Coach is developed and delivered by the team behind Primal Health Coach Institute, the first and preeminent ancestral health coaching school in existence. Primal Health Coach Institute has trained and certified thousands of successful health coaches across 75 countries around the world. We are experts in behavior change, and we understand how to get clients the results they desire. Our mission at My Primal Coach is the same as our mission with Primal Health Coach Institute: to help 100 million people reclaim health and wellness through education and coaching. Check it out for yourself at myprimalcoach.com. Hey, we love to see who's listening out there, so take a screen grab of your podcast player and tag us on Instagram at Health Coach Radio. By the way, the show notes for this episode and all previous episodes of Health Coach Radio can be found at primalhealthcoach.com/radio. Okay, without further delay, let's get on with today's enriching and beautiful discussion with our guest, Dr. Shamini Jain.
Dr. Shamini Jain is with us today, and we're going to talk about, well, I don't want to steal your thunder, but I think I feel comfortable saying a topic many health coaches have heard a lot about, might be curious about, but really don't know enough about to feel proficient to address it in any real way, and or just to know if this is a direction they want to go. So Erin and I know, are super excited about picking your brain on this. So thank you for joining us.
Thank you. It's a pleasure to be with you both.
We're just thrilled. So we like to start with every conversation with just an overview of who you are, but we would love to hear it from you. So would you give us the backstory on Dr. Jain?
Yeah, absolutely. Well, I have been fascinated with healing my whole life. That's really the kernel of my story, because growing up in the South, I'm an East Indian, a tradition, and grew up with a spiritual background called Jainism, which if most people haven't heard of, but if you've ever seen those monks and nuns that kind of walk around with coverings over their face, those are Jain monks and nuns. And so the basic tenet of Jainism is ahimsa. Well, so, here I am growing up in the South, a Jain, honestly, the only Indian kid in school. All my friends were Baptist Christian, and I would go to church with them, and we just sort of learn about each other's culture. And I realized that they were deeply spiritual people, and so was I, and we were curious to learn more. I would read all these books about how our spiritual practice and what we call now in the West mind-body practices could up-level our health. And even as a young child, I think being the daughter of a scientist, I was always like, how do they know that? Like, how can they make all these claims that things like meditation and yoga can really affect our health? And then when I was going to school, I realized that we couldn't really talk about those things. Like, you didn't talk about spiritual practices. You didn't even talk about consciousness. And though I was privileged to go to some of the best schools in the country, I remember getting my undergraduate degree in neuroscience at Columbia University in the 90s. They were telling us that our brains didn't change after age 7. So I started learning throughout my career how science evolves. And while, in the early 90s, you couldn't talk about brain changes after age 7, or even consciousness and healing, or some of these areas that we look at now called the biofield, that's evolving because science is evolving. And so through my research as a clinical psychologist and also as a researcher in an area called psychoneuroimmunology, they say if you can say that 7 times, you get your degree. Nobody likes to say that word. So we say P&I for short. We are learning how much power we really have and how much power we can facilitate in our clients by helping them understand how powerful the mind, body, spirit connection is. I mean, that's really, my journey is just sort of witnessing this evolution in the way that we understand health and the way that we scientifically explore it. So whether we're talking about physical healing or spiritual healing, we're learning that all these different aspects of whole person healing are incredibly powerful.
Ooh. When you were telling that origin story, one thing that you mentioned, I jotted it down. You said when you were going through your educational journey, we didn't even talk about consciousness.
Mm-hmm.
Can you help me understand what consciousness is? Can you define it for us?
You bet. I mean, it's such a fun term because it means so many different things to different people. And in my book, Healing Ourselves, Biofilled Science and the Future of Health, I go into this in some detail because there's ancient, understandings of consciousness, and then there are modern philosophical understandings. And actually, they're not always that different. So sometimes in science, when we talk about consciousness, especially in psychology, we might think of it as awareness, kind of like what my conscious mind thinks of and my subconscious and the unconscious. So that's one way we parse it out in psychology. And then in philosophy and in cognitive neuroscience, let's say, we could talk about certain aspects of consciousness as just awareness. And in some ways that ties into what we were learning about mindfulness. This idea of present moment awareness seems to have something to do with consciousness. But we can go even broader than that when we start exploring what modern day philosophers like David Chalmers say about consciousness, and what ancient spiritual traditions talked about as consciousness. And I like to refer to things as either little c consciousness, which is like awareness, cognition, attention, those aspects of what we call working, waking consciousness. But there's also a big C consciousness that many spiritual traditions talked about. And the big C consciousness really referred to a state of being that was in some ways all related to oneness, what we would call oneness, right? So different people describe this in different ways. But it was an understanding that even though you are, this beautiful separate person with your own mind, your own health behaviors, all of this, that in the big C consciousness framework, we are all actually deeply connected to a larger consciousness. So when we talk about consciousness in this way, it's really a unifying understanding. And what's interesting is while spiritual traditions have talked about this, across the world for millennia, we're just exploring in science what this means. So you have modern day philosophers exploring what this big C consciousness means in terms of our experience. David Chalmers talks about this as qualia. Some of you all may have heard that term if you've dived into the consciousness work a little. Qualia is basically my experience. Like, what is my experience like when I'm drinking a cup of coffee or biting into an apple? And is it the same experience as you? That's an aspect of consciousness as well. So you can see in some ways consciousness is in the eye of the beholder. And that's why we have whole conferences on consciousness. For me, because I'm kind of a pragmatist, I'm a clinical psychologist, my goal is to help people heal themselves. I'm interested in consciousness as it relates to healing. And so when we study things like placebo and mind-body practices, integrative health practices, and even things like energy or biofield healing, we start to understand how our consciousness, however we define that, can actually affect our healing process in really deep and powerful ways.
So there are so many terms in there that we have all heard that I still believe most of us don't even really know what they mean. Consciousness just being one of them. Relative to awareness, and how is that different? Or maybe it's just a different name for mindfulness, presence. So I would love, I guess, I don't know, a little bit of a tutorial about how, some of these terms that we hear, how much of them is just different terminology for essentially the same thing versus really very distinct and different ways of trying to express something. I just think a lot of this gets muddled into one big sort of vague lump for people that don't really, and some of this comes from the fact that, quite frankly, vast majority of us are going through life without any real sense of awareness or mindfulness. We're just sort of, in many cases, going through the motions to get from one day to the next. And it's where we get these feelings of just inadequacy or, I guess, just maybe incompleteness or unhappiness with the direction of our lives, because we're just sort of mired in going through the motions of day to day and being very unaware of all of these things. And so we hear coaches, I think anyone from the health coaching realm, very aware of the concept of mindfulness practices, right? And different versions of those. And is awareness just a byproduct of being mindful, or are these different things? Could you help us a little bit with some of the common terminology in this realm that might help describe this for people a little better?
I really like that you brought up presence, first of all, because that's really key. Again, let's just be practical. Like, from a practical level, we can debate about what consciousness means, where it comes from. There are people that say consciousness is the result of brain processes and neural firing, right? And that's what consciousness is. And other people say consciousness doesn't have to do with your brain. Your brain is a receiver for consciousness. Just like anything, you can debate about terms all day. Mm-hmm. In the end, though, what you said, I think, is the most important, Laura, because how do we work with our consciousness, whatever we call that, whatever that terminology is and that definition is, how do we work with that in a day-to-day fashion to be healthy, to be present, to be kind, right? And to be happy. And so this idea of presence, I think, is really key, because, whether we call it mindfulness, which in the West is described as present moment awareness without judgment, right? Mm-hmm. I like to describe consciousness as, sort of layers of experience. And so as we kind of go through our day-to-day rush, our mind is kind of driving the show, as you said. It may be actually driven by subconscious drives, like we have some inner desire, right, for achievement, or we want to be loved, or, what all these things that kind of drive our behaviors and our minds to think in certain ways. Well, if our subconscious desires are driving the bus and we're not even aware of them, then it becomes really difficult. But when we come into presence, as you say, and we can explore, what does presence mean? How do you get into presence? How do you help someone else get into presence, right? When we come into presence, we're entering that moment-to-moment awareness, and I would say expanding our consciousness. And here's the key point. When we're driven by subconscious desires, and there's nothing wrong with desire. It's great to desire. By humans, we desire. It's just the nature of who we are. But when we're not really aware of those, and sometimes they're driven by core beliefs that aren't really helpful, right? Like, I'm not worthy, I'm not lovable, those kinds of things that pretty much all of us carry on some level, right? Then we're really kind of stuck in ourselves in a way, and we're not seeing the vast totality of what's around us, what's supporting us, what we're actually connected to. So when we come into presence, we can listen better, we can feel better. One of the key areas that we've been forwarding is this area that we call biofield science and biofield healing, because it's helping us understand that our consciousness can actually reach out and touch another person in profound ways, that our consciousness, that is our state of being, can not only affect our health, but it can actually affect the health of other people. Now, to most people, that might sound really far out, because we're not used to thinking that my consciousness, this is beyond my thoughts, right? Like my consciousness, my energy can actually affect another human. Well, yeah, the studies show that it actually can in profound ways. And we're even seeing effects of human consciousness directed through energy practice to affect cells in mouse models of cancer, to reduce tumors in mouse models of cancer. This is research published at MD Anderson Cancer Center. That's how powerful our consciousness is. So how do we get there? The first step is to come into presence.
So I love this so much. And I also feel, and this is so interesting, speaking about presence and how we talk about ourselves to ourselves, but I feel like I will never fully understand this. I want to so badly. I'm going to completely butcher this, but I was listening to a podcast interview with someone and they were describing this shared consciousness sort of idea, how our energy influences the energies of other people, and use the analogy of the sun. And the sun is actually not hot. It's not that hot, but it gives off energy, and the way we bring it into the body makes us feel warm. But the sun itself is actually not hot. It is simply energy, and we're sharing it with the sun, and it's making us warm. And then he used that example to just to exactly what you said, that our energy influences each other. And I really want to wrap my brain around that, but I can't.
It's really difficult. Well, I will say I have you covered, because in my book, Healing Ourselves, Biofilled Science and the Future of Health, I have painstakingly documented, all of this research in these areas of consciousness and healing. So there are over 700 peer-reviewed research references in there, really outlining, first of all, what do we know about this from a philosophy standpoint? Where's the evidence? What's the evidence behind things like placebo and mind, body, spirit practices like yoga, meditation, and Tai Chi? And then what about this area called energy healing? Because that's really the leading edge. When we start studying things like energy healing, then we're really pushing the envelope to explore this idea that we've been living kind of a little bit under a fallacy. First of all, it was only 50 years ago. I don't know if you guys know this, but it was only 50 years ago that the reigning truth was that our minds and bodies didn't have much effect on each other, that our emotions didn't affect our health.
Right.
And it was through my home work, in my institution or my line of research, P&I, psychoneuroimmunology, that we discovered, oh, that's not true. Actually, our immune system's connected to our brain. And that helps us understand how our emotions can affect our physiology. Now, when we look at biofilled science, I'll just give you one really simple example of a study that was done by Dr. Kathy Kempfer at the University of Ohio. Most of us are familiar with meditation, so let's start there. She looked to see what would happen if a person who was pretty skilled in loving kindness meditation, so this is where you're literally coming into presence, as we talked about, coming into a state of awareness and allowing yourself to feel loving kindness, a sense of compassion and love for another person. She did this where two people were, first of all, in the same room, and she hooked them up to just sort of look at what happens to their heart rhythms. You might have heard of heart rate variability. That's what she was looking at. It's basically a measure of our sympathetic and parasympathetic nervous systems, how well we harmonize, right? What she found, and she had different kinds of control conditions where the person who was sending, loving kindness was in the same room with someone receiving it. And in one case, they were just both sitting and reading. That was kind of a baseline condition. So one wasn't trying to influence the other in any way. And then, in other conditions, they were just sitting in silence. In one condition, the meditator put her hands on the person and said, I'm going to send you loving kindness, and did it. And in the other, the loving kindness meditator actually pretended to read, but sent the receiver loving kindness without that person knowing what they were doing. She found that just by sending someone loving kindness, even if they didn't know, compared to control conditions, their heart rate variability would increase in a way that their rest and digest or parasympathetic nervous system would relax. Now, we've done other studies with healing practitioners who kind of follow a similar model. They do something called grounding. They come into presence, and then they allow themselves to simply be a conduit for energy to move through them, much like you were saying, the sun, right? It's just an energy, and then the way we perceive it is a whole other thing. Well, there are over 400 clinical trials of these kinds of studies with what we call biofield healing techniques. Those include things like Reiki, laying on of hands, healing touch, all of these different kinds. And when we compile all of that data together, we see strong effects on pain, on anxiety, reducing symptoms of dementia, and some really incredible findings with cancer patients so far. A lot of studies are ongoing, and I detail all of this. There's clinical studies with people, there's studies with cells and animals. And if we link this idea of that energy, right, that you're allowing yourself to essentially be a conscious conduit for energy. And by the way, all of us can do this, right? This is not something that you necessarily have to be fully trained to do. It just depends on how you do it. The bottom line is, not only does it help us to come into a state of present moment awareness where our subconscious isn't driving the bus, because we don't want that when we're sitting with a client, right? We want to be present. We want to listen. We want to feel. We want to help. So that's step one. And then knowing that that presence, that ability to fully stay present and allow energy to move is actually having a healing effect in and of itself, even above and beyond in some cases what you might prescribe. Now, I realize what I'm saying is pretty provocative because it almost goes against the way we've been taught to think about medicine. We've been taught to think, I'm suffering, my suffering is outside of myself. I have to go to some outside agent, like find a drug, find a supplement, find a healer, find something to help rid this problem that I have from me, right? But the data, when we look at placebo and energy healing, these data are pointing to the fact that we ultimately are our best healers. And what we're doing, as health facilitators, health coaches, doctors, psychologists, we're facilitating that process for that person. We're facilitators. So we come into presence and we help facilitate, we listen, and then the client learns, right? The client learns to listen to their own energy. They listen to their own, we allow them to come into presence so that they can heal themselves much better.
We talk about this. Thank you for saying that as health coaches, we are facilitators, because I think so many people, we talk about this all the time. How about it, Erin? How many people come to health coaching, think it's their role to be the expert and tell people about what they need to change and all this other thing, when in reality, what we are is facilitators of change. And we talk about in our training about the importance of being present as a coach and creating a safe, and we use the term space, right? This sort of like open container for, in your words, energy. I'm not sure if we actually use that term in our course, but that's essentially what it is, right? Creating this open, loving, welcoming space for our clients to be able to express themselves. Because we do believe as health coaches, at the end of the day, our clients have an inner knowing of their own about kind of where they are from a health perspective, if given the chance to see it. And just anecdotally, I know I see this with my clients. And a prime example of this actually is my mother, who for years was so sick, but she was so unaware of what feeling well felt like. She had no idea how sick she was. This is a woman who spent a month in the hospital. She had such advanced diverticulitis. She had to have a colon resection. But for years, no idea. I'm like, Mom, how do you not have any idea that it got that bad? But she was feeling so bad for so long. It's almost as though she lost awareness of what being well was supposed to feel like.
And maybe because she lost awareness, as you said, right? She lost awareness of her body. She lost awareness of what was going on with her emotional state. Maybe she was in a go, go, go kind of framework. Look, we're all guilty of it to some degree, right? To some degree more than others. But I love what you said, because, it makes me think of Carl Rogers. For those of you who don't know who Carl Rogers was, he was the founder of humanistic psychology. He was famous for his sessions with clients where he literally sat in silence. He didn't say a word. And, the psychology scientists would go crazy scratching their heads because he would have these incredible outcomes. And they're like, what's going on? There's no CBT. There's no cognitive behavioral therapy. There's no homework. You haven't guided this person at all. You haven't said anything. And they said, what is responsible for these effects? And he used to call it unconditional positive regard. Yeah. Because he probably didn't feel like he could just say love, right? Or being in loving presence, or however we might describe this. But linking back to our earlier conversation about consciousness, we're allowing for that widening to take place. So that doesn't mean that they don't need your skill, right? I mean, all of us know, I mean, we have to help people get out of their own way. That's a lot of what we do, right? And we have skills to be able to do that. We have practical recommendations for aligning their diets or aligning their activity or, all these things. Those things are important. And when we look at the data, what we see is that all of those recommendations are so much more powerful if we can first come into a state of presence and then help the person come into a state of presence. So those recommendations are really heard and felt. And then they're not coming from an ugh place, right? But an ah place. It's not like, oh God, I got to go exercise 3 times a week this week. It's like, oh, if I come into awareness, how's my body feeling after I exercise, right? So this is so easy because we can just simply give them practical tools for, hey, after you exercise, like check in for a second, journal, like what did that feel like? Oh, well then, the self-reward kind of starts to happen. They have their own internal motivation. It's a great thing.
Yes. You're speaking absolutely our language here. We, Laura and I work for a school that certifies health coaches. That's what we do. Sort of our main gig in this podcast is our fun side hustle. And in our curriculum, in our advanced coaching curriculum, we have a whole chapter called Client Emotion and Energy. And when we get to this chapter, I get the sense that our students are like, what now? I thought I was just going to tell people how to eat and how to exercise. We talk about unconditional positive regard. We teach to it. We teach to intrinsic motivators, which you just kind of mentioned at the very end there. And it comes down to kind of what Laura said, is that the belief that this idea of self-efficacy, the client has to remember, I guess, in manner of speaking, remember that they have the resources within them. It's like there's a forgetting that happens, and our role is really to help them remember. And we do that through active listening. And I love the example of the fellow sitting completely silently, because it's insanely powerful to just hold that space for a client who will start talking and working through thoughts and troubleshooting their own struggles. And yes, we are there to provide information. We are there to educate in some degree, for sure. But this idea of holding space, actively listening, is incredibly powerful. But it's very much, it feels a little uncomfortable for the health coach, nutrition coach, fitness coach who thought they were going to be more in a prescriptive role.
Well, there's another framework we can use to help us understand how to take the best of what the scientific data is telling us about mind-body processes and how to use that in a coaching situation or in a therapeutic situation. And that's placebo, really. So I have a whole chapter on placebo because it's amazing. I actually have a whole framework for it that I call placebo equals heal, or holistic elements that activate life force. Now, I know some people don't like the term life force, so you can say holistic elements that activate salutogenesis, which is a fancy scientific term for the processes of health. We think about pathogenesis as the process of disease. Salutogenesis is the process of health. So what we know about placebo effects, first of all, is that they occur in every kind of health encounter, actually. We see placebo effects for robust things, including drugs for pain and for depression. Our colleagues at Harvard University have determined through really carefully systematic meta-analyses of hundreds of studies that for mild and moderate depression, most depression except for very, very severe refractory depression, 75% of the effect of antidepressants on depression are due to natural history effects and what we call the placebo effect. Okay. Placebo effects are also found in surgery. I overview this because a lot of people don't know that, but there are actually systematic reviews, again, compiling the data across dozens of randomized controlled trials showing that placebo effects are robust in surgery. So people often say, well, Shamini, what do you mean by placebo effect in surgery? Like, how does that work? These people are enrolled in a randomized controlled trial. So they know they're in an RCT, right, randomized controlled trial, and they may be sent to a group that actually gets surgery and a group that gets what they call placebo surgery. So they do know that when they're going in, but they're not going to be told which one until after the study is done. So if they're randomized to placebo surgery, they will get anesthesia. They will be wheeled in like they're getting surgery, and they may even get a little incision that makes it look like they got the surgery. Okay, so when they come out, the surgery was great, blah, blah, blah. And then they track them over time. Well, guess what? In most of the cases of surgery, except for classical surgery, and I've got diagrams and stuff like that in my book, And this is for, GERD and, all kinds of different surgeries, bariatric surgery, lots of different types of surgeries. There are huge and profound outcomes of the placebo effect on surgery. So even though even though they thought they got the surgery and they didn't, they're still seeing outcomes. A couple other things I just want to highlight so we understand how profound this so-called placebo effect is. Our colleagues at Harvard are now showing that you don't even have to trick someone to get a placebo effect. They're actually doing what they call open label placebo studies. They're giving people placebo pills and saying, I'm giving you a placebo pill. And placebo has been shown in studies to have a powerful mind-body effect. So it's possible when you take this that you may see a benefit. They are seeing benefits in things like chronic fatigue, irritable bowel syndrome, chronic pain. And they just got funded by the National Institutes of Health, multi-million-dollar study to look at this more deeply. So what does this mean for us? Because we might think about placebo effects with things like energy healing or acupuncture, but they're happening in surgery, they're happening with drugs. Well, we kind of have it all backwards because we used to think that it was all about that active ingredient, whether it was a drug, surgery, CBT, cognitive behavioral therapy, whatever. Maybe what placebo is teaching us is that there are fundamental elements that we can take advantage of for our own self-healing. And we can incorporate those into our therapeutic encounters very, mindfully, right? To up-level the healing potential of our clients. So what are those elements? Okay. We've looked at this, scientifically and kind of parsed out specific, what we call placebo elements, or I call heal elements. One is expectation. Mm-hmm. How much I consciously think this is going to help. How much do I think exercising is really going to help me, right? Related to self-efficacy and other things too, but just my mindset, okay? Conscious mindset. Conditioning refers to a conscious and subconscious process where it's like how much of my body mind remembers what happened the last time I did this? And is that going to influence my response? So I'll give you an example. Most folks feel pretty good when they get a massage. Conditioning would be like, I got a massage. I'm going to go lay on this table again for my second massage. My body mind relaxed a lot last time. So your body mind already starts to go into a relaxation mode when it gets on the table. That's conditioning. We can take advantage of that, right? In health coaching. Relationship. We talked about this a little bit already, right? Coming into presence, being loving and very there has huge effects. We have studies showing that when a health provider, in this case, these were medical doctors, is nicer to their patient, you can actually reduce the length of the common cold. That's been shown by science, so it has an effect all the way down to the immune level. And then finally, ritual. I'm a big proponent of allowing people to create healing rituals, and I outline this in my book. The third part of my book is called The Healing Keys, and I go over really fundamental practices that we can all do to up-level our healing. Ritual is a huge one because it helps us set our intention, our conscious expectation, understand what our drivers are. I've had some colleagues actually write me recently and say, I've been following your prescription to just set a healing ritual for myself, 15 minutes a day, as you've suggested, and it's made a huge difference. So ritual is encouraging our folks to take a sacred space, make it sacred space, sit down, come into presence, do a mind-body practice. I give very prescriptive ideas in my book, but really you can take this and make it your own. But when we look at all those placebo elements, they're so powerful, and I really believe that, again, it's really speaking to the power of our consciousness, both our unconscious, our subconscious, and our waking consciousness, right, to up-level our healing.
Oh, yeah. It's funny when we were talking about this before we started recording about how sometimes a lot of this stuff gets stuck in the woo-woo camp and people, but the fact that there's even a placebo effect tells you that this is not woo-woo and that this is recognized by science, that you have to have a control group to disprove this, that the power of expectation and the mind and belief on the body's ability to heal has been known for so long that it's literally a part of every randomized control trial.
Yeah, and instead of getting rid of those effects, instead of trying to do away with them and randomize control for them, we should actually be maximizing them. That's the point.
Harness it. Absolutely. And so this right there for all health coaches listening, I hope gives you a tremendous amount of confidence in our own ability to help affect change for people that has nothing to do with what they're eating, nothing to do with moving. I mean, yeah, all that stuff's important. But really at the end of the day, it's about thoughts and feelings and emotion and energy and harnessing that to help our clients feel better and to trust in it.
Really true. And as I like to say in the book, healing's not an either or. Okay. Healing is a return to wholeness. It's about restoring harmony in yourself and harmony in your relationships and your relationship with the world. You know, the cosmology, the ancient cosmology of understanding that healing is basically a return to wholeness and connectedness is far more than just getting rid of a disease. And because healing is not an either or, it's a both and.
Mm-hmm.
All of it is important, right? We understand diet, exercise, medications can be really important for a patient, or a client. But if we begin with consciousness, then we're just that much more empowered to do what we need to do.
I love that term wholeness because, so my role at our school, one of my roles is as admissions director. And when I talk to people that are coming from a different profession and are curious about this, a lot of times what comes up is, they're interested in making a change because where they are right now, like something's missing. Something is just missing, like this, not following this passion that they have somehow gives them a feeling of incompleteness. And I think that the concept of wholeness and feeling as though we are manifesting all that we can by following this path and following this calling that I think we can help harness as coaches with our clients. I mean, most of the people that I work with, I'm not trying to cure anything. Most people they're just looking to feel better. Perhaps they do have a condition, but at the end of the day, they're looking to lose some weight. They're looking to do these things that they know are going to move them closer to wellness. And I think we need to really harness this concept of rather than feeling incomplete and moving forward and like they need to rely on me to feel complete, it's what can we work together as, with our relationship to help that client feel whole within themselves and that the power is there, giving them back that power. And then that then leads to all the behaviors and all the habits and the choices that are the other logistical pieces of how do I eat and how do I move become so much easier.
And if that thread that connects it all is consciousness, then here's the cool thing. The reason I say it starts with consciousness is because, and let's just say awareness, if that's an easier, thing for us to grok for a moment. If we're aware of our thoughts and our emotions and our drivers, and we're aware of how we're feeling when we do things, and we're kind of moving through life with that broader awareness, and we're putting that awareness first, then we start realizing how all these things are really interconnected, right? We begin to connect the dots, like coming back to what we like to call whole person healing or whole person medicine. Well, my thoughts aren't separate from my emotions, and they're actually not separate from what I eat, and they're not separate from my relationships. So if I start with awareness, I begin to kind of connect the dots of all of these different aspects of my being. And that's why it's so powerful when we work with these consciousness-based practices, whether they are things like yoga, prayer, meditation, tai chi, energy healing, we're allowing for that greater awareness to surface itself, and then we start seeing these ripple effects on the physical level, on the interpersonal level, on the emotional level, because they're all connected.
Yeah. I'm grateful that you have like tactics in your book, because I get this, like this, I get this. I love this. And I want to do it. And then it's like, but I'm not a good meditator, or I don't enjoy Tai Chi that much, or whatever. But
Yeah.
there's lots of different ways to do it. I have an anecdote to share that I think plays this out a little bit, and I would love to hear sort of your take on it. This literally just happened before we got on this call. I had a client call, and I won't give you the full backstory of this client, but she's struggling with some health stuff that she wanted my help with. And in just getting to know her, she works for this very tyrannical boss. She has a very, very tyrannical boss that is honestly it sounds like a really like a real maniac, just always asking too much of her. And she's worked for him for a long time, and she can pinpoint the fact that her health struggles started when he started getting really bad. And so, and really just holding space for her, we kind of uncovered that her chronic stress is chronically being in sympathetic, nervous system state all the time with this guy was, affecting her at an energetic level and potentially influencing her health. And she knows that. People know stress is bad. Anyway, she quit her job. I didn't tell her to quit her job. She quit her job.
Wow.
And
that's great. I mean, I want to say that's great, but
I know. I said the same thing. I was like, thank you. Anyway, she's putting in her notice tomorrow, but she made this decision a week or so ago. And then she had to think about it. She had to put some thoughts into action, because like, you quit your job. Now my income is gone. What does that mean? How does my life change? How do I support my household? And she can do it. So she has some privilege where she has some money saved up. So it's fine. But had to go through the exercise of knowing herself, in a manner of speaking.
Mm-hmm.
So I don't have this job and this tyrannical boss anymore. What can I do instead? How am I going to, what's my life going to be like? What is my day going to look like? She had to honestly inadvertently go through a visioning exercise.
Mm-hmm.
And she got on the phone today for our client call. And she said, I don't know what is going on, because I literally didn't change anything, but the scale weight dropped. My pants fit looser. I slept soundly. I've been sleeping soundly for the first time in recorded history. Is it because I quit my job? And to me, I think it's because of all the other internal work that was adjacent to that. What she said was, this is what's so funny, and why I was so excited to talk to you. She said, probably just some kind of placebo effect, right? And I said, who cares? Like, who cares? Like, who cares if it's a placebo effect? Now, I don't think who cares is the right answer. That's what I said. Like, who cares? It worked. What do you think? Like, what do you think? When
we could really actually break this down, because what we see are placebo effects, are mind-body effects. One thing I didn't mention, but I go into detail in the book, is that placebo effects, we actually see them all the way down to neural firing levels. Because expectation, conditioning, relationship, and ritual are understood by us, and because they're related to changes in emotions and attention, what happens is we see effects in the mind and body. So, and by the way, I really appreciate you sharing that story. I have a colleague who has a very similar story. Actually, I suspect that this is a very, very common story among many people. And let's talk about emotional toxicity and the release of emotional toxicity for a moment. Now, many folks in the energy healing community will talk about the relationship between energetic and emotional toxicity and the lymph. Okay. Mm-hmm. From a scientific point of view, what we do know is that when we are holding stress in the body, there are potentials to have water retention, let's say, in the body, right? So you have all this water retention in the body. Your parasympathetic nervous system is perhaps not as activated as it needs to be. Then when you come into a relaxation response, the body begins to start regulating itself. You're actually getting into a deeper restorative immunity if you're sleeping. Let's say you haven't been sleeping well and you start sleeping well, right? All of these things are happening. So you're literally having a clearing away of debris in the lymph that needed to be cleared away. This is why when people are stressed sometimes, or upset, or they're holding emotions and they're not letting them go, the energy healers have been talking about this forever. Everybody thought they were crazy, right? From the psychoneuroimmunology perspective, and you just look at the physiology, you begin to see, like, why did her pant size just drop all of a sudden? Well, she probably lost water weight, right? Her scale, probably water weight, because she's no longer holding that emotion. So whether you want to call it placebo, the effects of emotion on physiology, these are very real effects. Mm-hmm. And one thing that we know from looking at the placebo data is it's not just one neural pathway. It's actually based on conditioning. And I won't bore you with the details. I go into a lot of details on this, in the book, but say we've been taking, like, for example, a medication for pain that was an opioid, or kind of like worked in the opioid pathway. When we get a placebo, our pain relief from that placebo will be through the opioid pathway. But if we were taking a non-steroidal anti-inflammatory, it would affect a different pathway, and our placebo response would actually be in that pathway, because it's related to what we call our mind-body conditioning, right? So I would say when people start talking about placebo effects, really what we probably ought to be saying, or if you don't want to say heal effects, you would say mind-body effects, because that mind-body connection is so powerful. And how great for your colleague that she's just up-leveled her health, understanding the relationship between interpersonal health and physical health, right? That there is that relationship and it's really real. And she had the power to do that, right? She made a health decision.
Yeah.
It's huge.
There's just some nebulousness in, as a health coach, when your client shares something like this with you. There's in trying to explain it. I don't even know why I felt compelled to explain it truly. So this helps though.
Yeah, the psychoneuroimmunology model is really our anchor here. You know, if we really want to talk about it in terms of direct physiology, you know, the science is very clear on this. Our emotions affect our body. We've learned this over the past 50 years. There's so much more to explore, but our positive emotions in some cases can buffer our states of health. In older women, it's been shown that when we hold more positive emotion and what we call eudaimonic well-being, a sense of well-being that's related to purpose and relationships and self-mastery, it's actually related to having a longer life. It's also related to health behaviors and all these things, but it's related to shifts in immune function and hormone function, right? So it's all through this pathway of understanding that when we feel something, it's affecting our brains and our organ systems, not just our minds out there as some nebulous thing.
Right.
Yeah. So when we talk about some sort of tactical, and I'm sure your book goes into this. So before we go, I just wanted to make sure everybody knows where to find it. But just, you know, if for people curious on what they'll learn in the book, are there some tactics written in there? Or can you share some tactics that would be within the realm of a health coach that doesn't have a PhD in this stuff, and where this might fit within the context of a coaching relationship through conversation or what have you?
Absolutely. So the third part of the book, The Healing Keys, is really simple, and it's something all of us can do and that we can coach others to do. That doesn't require you to get a degree in energy healing or be a fancy meditator. You know, you don't have to do those things. So let me just go over those key steps. And then
Awesome.
you know, in the book, there are exercises, kind of practical exercises that we can do with our clients. So the first is what I call grounding. Okay. Grounding is about coming into your body and actually bioenergetically connecting with the earth. So what this is about is really utilizing the breath, coming into the body and feeling a strong bioenergetic connection so we can come into presence, like we talked about earlier. Okay, so that's step one. The second step is to flow with emotions. I have exercises in there around breathing into discomfort, you know, specific things that we can do if we're feeling down. How can we up-level our mood, right? So they're very practical things about dealing with our emotional health and allowing ourselves to flow with emotions, not stuffing them, not pushing them away, not getting so embroiled into them that we're constantly riding a tsunami wave, right? But really learning how to flow with those, feel them in the body, and breathe into discomfort. That's one of the practices that I share, is how do you breathe into discomfort and let go of stagnation or irritation that you feel in the body related to an emotion. The third, I feel, is pretty overlooked, but incredibly powerful and important, and that's coming into our creativity for healing. Very easy ways to do that. The data says that just by being creative every day, which can be just cooking a fancy meal or wearing a fun outfit or just singing around the house, literally, the data shows that when we do those things every day, our mood is up-leveled. The fourth is coming into powerful healing intention, and there's where I give some real practical wisdom and guidance on setting your intentions, creating a healing space and ritual that really works for you. So now we've come into our bodies, we're feeling our emotions, we're recognizing what our desires are and what we're asking for healing, right? And then the next step is actually connecting with support. And I share bioenergetic practices, kind of like mini meditations that anyone can do for coming into the heart space and opening and asking for support. There's also some practical wisdom in there on how to energetically send someone healing and how to energetically disconnect from someone if you're feeling a lot of toxicity, because that's a big thing that comes up for people, right? Now, the final key is maybe the most important. It could be the first step, but it has to absolutely happen, and that's surrender. At the end of the day, we come into our bodies, we feel what we feel, We understand what our desires are, we ask for help, and then we release it. And this comes back to consciousness, because we only know what we know as conditioned beings, right? So we may have an idea of what, it looks like. And this is one of the practical things I teach people is, well, I want to have $1 million. Okay, why? Like, so we get into that. What's going to happen when you have $1 million? So instead of holding on to that thought, I'm going to have $1 million and getting all anxious around that, you actually release it. And if anything, you may envision, what's going to happen when I have that $1 million? Like, let me go into that. And let me go into what that feeling is going to be like. Now I'm actually bringing, that reality closer to me because I'm feeling into it, not trying to think my way through it. So surrender is a really huge part of the process.
Ooh, I'm very grateful that you've put these steps. It feels logical for somebody who maybe their own logical mind prevents them from entering into a practice like this. It's a nice bridge, I find. I really am very grateful. Another book I have to buy. Geez, I buy a book every time we have a podcast.
We'll send you one.
But there's so much about, the way you've communicated it is different and broken down by steps, but we've had many guests on that talk about that, why emotions are so hard for us and why we try to avoid them so much. And it's not the emotion, it's the feeling inside, the pain, right? Inside, that the physical manifestation of that emotion that we're really trying to hold off. And that the more we do that, the more it stays inside us, that we've got to, and I like the term you used, which is kind of riding it, with the flow and letting it go. Other guests we've had on use different terminology, but that makes a lot of sense. And that the way that you've broken it down into some steps, kind of helping our listeners pre-experience a little bit about kind of what this process is going to feel like, or some sort of order to it. I think at least for someone like me, it makes it a little less scary that these are the steps. Yeah. I'm used to following a recipe.
And there's a logic to them, because as you come into doing these practices, you realize that coming into presence, and again, having more energy literally in your body and mind to be able to work with the grief when it comes, the things that you're holding on to that you don't want to release. That's why, we ground ourselves. We really make sure that we're feeling our feelings as much as possible before we get into the space of setting intentions, and we ask for support. And when we open the heart, and I talk about this in the book, things are going to come up, right? Because we hold a lot in the heart, we hold a lot in our emotions. But literally by going through these practices of asking for support, you can feel yourself literally as if you're being hugged. I have some meditations on an app called Insight Timer, and I think also on my YouTube if people want to tap into them. And I have there's an audiobook to this too that has meditation. So the book is available at hardcover and Kindle and audiobook, I think on Audible, and the book is found everywhere. When you dive into these really short mini meditations and allow yourself to feel that support, it allows the letting go process to happen much easier. So there's a method to the madness in terms of why you follow the steps in order the way you do, because it really helps with those issues of, holding on, because we all hold on.
Mm-hmm. I think that's actually my favorite part when you're reciting those steps is the support piece, asking for it, offering it, also energetically disconnecting from maybe energies of people who aren't serving you. I have one very annoying tactical question for you, because the grounding piece, the grounding, actually putting your feet on the earth, that's really important, right? How do you do that when it's cold out?
Yeah, it's a great, so here's the thing. The studies that we've done have looked at us literally bioenergetically connecting to the earth using things like grounding mats and things like that, right? But mind-body grounding practices have been around for millennia. And so there are ways you can do that, believe it or not, even if your feet aren't directly touching the earth, because you're still coming into your body and you are spiritually connecting with the earth. Now, that might sound kind of woo, but I would suggest just try the practice. So I do have some grounding meditations that are available for free on my website. And on my YouTube channel. Literally what you're doing is you're taking a moment to breathe. And you're sending that breath all the way down the body into the feet and allowing yourself to feel the feet for a moment. And then when you do that, allow yourself to just feel as if you are a tree sinking into the earth. When you do this, and you can call it imagery, you can call it whatever you want. When you do this practice, you'll actually feel a difference in your energy. You'll feel a difference in the way that you feel in your body. You'll become more grounded. Part of that is, you're slowing down your breath, you're activating the vagus nerve. Some of that is going on, but there is a bioenergetic and spiritual component to this, because when we study this area that we call the biofield, it helps us realize how deeply we're connected. The ancients knew this. When we come into practice, we begin to realize it for ourselves.
Yes, Erin lives in Calgary. Sorry, it's cold.
Coldness, not a factor. Don't have to be barefoot on the snow. God bless you. That would be hard. I know it would be hard for me to do. If you can be barefoot, it's good, right? But stand on your floor. You got a tile floor, or even carpet or rug. Doesn't matter, but you can still do this practice, and you can really feel the groundedness in your body when you do it. It's amazing.
Mm-hmm. I'm looking forward to trying it.
Yeah.
I had a small, I experimented with, this is probably way off topic, but psilocybin journeying this summer was something that I played around with. I shouldn't say I played around with, it was very intentional. And the connection that I felt to, honestly, those little mushrooms and the mycelium network and every root of every tree on my property here has been palpable. And I wasn't anywhere near them, but just being able to kind of call into that aspect of nature, and that really helps. That helps a lot, actually. I'm really looking forward to having it. Yeah,
that's so amazing. What a beautiful experience. And then the more and more we're learning about the rootedness and connected of trees, and we realize that trees are just part of Earth's great creatures, maybe we're much more connected with each other than we ever dreamed or realized possible.
Mm-hmm. My gosh, for me, it's the beach and the ocean and the flow and the waves and all the creatures in it and what's on the other side, and what's connected through there, the energy of all that and how it ties with, I just, part of the reason I moved to Florida, because that really, I feel very called there. It's kind of my happy place. And when I'm just kind of need a timeout, I'll go drive there, even if it's just a 10-minute walk on the beach. Totally resets.
Everything. Yeah, Earth is our biggest healer. And I feel you, Laura. I'm a surfer. I was in San Diego for about 20 years, and I recently moved, and the hardest thing for me was leaving the ocean. So luckily I have this beautiful creek that runs through my property, so I don't get to surf it. My dog sure tries to. But, I go and put my feet there on the earth and just watch the water, maybe take a scoop of it, and feel that flow and realize I'm a part of something that's much larger. And, again, coming back to what we do with our clients, I think when we can come into that state of groundedness and presence and realize that we're all part of a larger whole, it makes the whole process more fun and way easier.
I love it. Yeah. Awesome. Okay. So tell everybody where they can find. So first of all, where can they find you and follow you? But then also kind of where can they find the book? And what should they be looking for?
So my name is Dr. Shamini Jain, and you can find me on IG and Facebook and Twitter and LinkedIn at Dr. Shamini Jain. I'm sure hopefully it'll be in the show notes, because I know that's a hard one to spell. The easiest way to you can get the book anywhere you want, but if you go to healingourselvesbook.com, it's just all one word, healingourselvesbook.com. Do consider going there, because I have a bonus form for you that's going to give you all kinds of really wonderful things, free meditations, free interview dialogues that I've had with my colleagues, Deepak Chopra and Bruce Lipton and Donna Eden, and some of the leaders in kind of the healing field. So you'll get free access to those videos. And more. I have a free ebook on Biofilled devices, which we didn't even touch on today, but all about bioelectromagnetic devices and other devices. What do we know about them? What does the evidence actually say behind them? What should you do? Should you use them? Should you recommend them to clients? So go to healingourselvesbook.com, get the book, and then just sign up for all those free resources. Lastly, if you're intrigued to learn more about consciousness and healing, check out my nonprofit. It's called the Consciousness and Healing Initiative. We have free webinars and Ask Me Anything sessions every month with leaders of the community. They're totally free. And you can sign up and be part of our community. You go to chi.org/ chi.is, or chi.is for Consciousness and Healing Initiative.
Oh,
I love it. Awesome. All sorts of kind of really cool resources. Thank you so much for bringing Erin and I and our audience into this, I guess, just the energy of healing. And I've learned a lot, and it's a constant reminder about just how much good we can do without ever talking about food, never talking about macros or workouts, but just the body's ability to heal and just how powerful that energy is. So thank you.
Well, thank you. It's been a pleasure. Thank you, ladies, so much.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.